We have some questions already coming in. You can still submit a question. Just put it in Zoom chat or the Facebook Live comments. I now invite our talkers to come back to the Zoom stage, turn on their cameras, and I have a few questions to get us started. Nice to see you all again. At a high level, how is youth mental health different from adult or say even seniors mental health? Terry, I'll start that one with you. Obviously, younger stage of life, developmental stage, but I would assume there's more to it.
And thanks, that's a great question. I think one of the things that we talk about when I talk about with teenagers is that after the preschool years, really your brain is changing the most when you're during your teenage and early adult time. So this is a huge time where really, really important kind of skills and connections are coming online in terms of your brain development, in terms of how we think and cope and process things. It's also like one of the most important periods of time in terms of our social brain. So, and that's not at all surprising to anyone who's been a teenager or has teenagers or works with them. Their social connections are really major drivers of decisions. And so, that takes a really different approach than if you're working with someone in their adulthood or also during their child years. It's also, of course, a time when it's a major shift. So for those who grow up in, within a family, whether it's, a biological family or a found or adopted family, there's a shift from the kind of the influence of caregivers or parents towards really a growing influence of other relationships, friendships, romantic and sexual relationships. So all of those things kind of come into play. They're important influences that increase.
There's a lot happening in those first 2 decades.
Absolutely.
And go ahead.
No, I was just going to say it's a unique time. There's no other time like it, really.
Well, yeah, I sometimes think back to high school or see what teens are navigating and think, this is horrible and impossible and amazing all at once, right? This is why so many movies and TV shows are made about high school, because of all the stress involved in that period. And of course, our conversation extends much earlier. I also just want to clarify, especially for those not in the field, how is mental health different from mental illness? Because we often hear the terms used. Myrna, can you kind of just explain what the difference there? There's some overlap, but I just want to make sure we're using the correct terms.
Well, yes. A lot of people think that mental illness is the absence of mental health. And to some extent, there is some truth to that, but that's not quite it. Mental illness is debilitating. It's debilitating. It's not just a simple anxiety. It's not a simple thing like, I feel depressed today. I didn't get my meal on time. I'm depressed. I don't have enough money. That is not that. And we often use those things interchangeably. And on the one hand, we're talking about wellness. We're talking about coping strategies. We're talking about being able to face life, make good decisions, and cope with it. On the other hand, we're talking about something that can be debilitating, something that drains you mentally, physically, something that makes you feel hopeless and helpless. To me, those are the primary differences.
Great, thanks. Anyone want to build on that?
I think I honestly, these are like, I'm not a clinician, but these to me are things that we're still trying to understand. Like, what is the interplay between the biology, between illness and between socioeconomic factors? Like, I think that piece, I don't know the answer to the question of, can we decrease the rate of mental illness? I do believe that we can decrease poor mental health. We can increase positive mental health. But I genuinely think a lot of this, like when I think about our wealth of research, we've only been researching this for a hot minute in the grand scheme of things. I think we still don't understand more than we actually do. I think that's why we still don't have the perfect solution to these problems, because they're complex problems and we're trying to find the best interventions. But I actually sometimes find the question isn't a necessary one. If you're struggling, if you're in crisis, if you need support and you deserve access to that support. And sometimes access to a diagnosis is still a thing that is used to deny access to care. And so until we're at a point where everyone has the services they need, I think the question isn't a necessary one. I think when everyone has essential services, then we can figure out what the research says.
I'd also add in, like, I frame mental illness very much as it's a social construct just as much as anything else is, which is not always like a super popular opinion, but like, if my grandmother hoards more National Geographic magazines than she could ever possibly read in a lifetime, we see that as an illness. Whereas if a billionaire hoards more, Lamborghinis than they could ever drive in a lifetime, we don't see that as a mental illness. And so that's really influenced by what we value as a society.
Oh, that's such a juicy thought. Thank you so much for that. Faye, I want to come back. In your talk, you highlight how many of us are comfortable talking about, say, anxiety or depression, but when it's a panic attack in public, we start getting uncomfortable, or say borderline personality disorder. I will say, reflecting on my own experiences, sometimes I've been in situations where I feel I don't have the expertise, or I'm not sure how to best offer support to a friend or family member struggling. How can one best navigate it if we're feeling uncomfortable or it's outside of what we know?
I think that's a great question. I think that speaks to something a lot of us feel. We feel this, our own sense of anxiety, when we feel like we don't have the answers or the right response or the right intervention. Spend a lot of my time working with folks on like LGBTQ inclusion. And this is a similar barrier, right? It's the, oh God, I'm so afraid I'm going to say the wrong thing. Almost all of the time, if you ground your response in the, you aren't expecting me to know everything, you need someone to listen, you need someone to support, you're going to be good to go. And we all actually have different approaches. When I'm working with young folks in crisis, and I've done like peer intervention type stuff, especially early in my career, I use jokes and awkward humor and it responds to the young folks that I've worked with. And that is my approach. And so I think a lot of it is you don't need a checklist. You need it to lean into a relationship, treat folks as folks, as people, as humans, and ask them, what do you need from me in this moment? How can I support you? Be intentional around boundaries. Like, don't, hug someone if you don't know if they want to be hugged. Don't, be intentional on that front. But a lot of the time, if you ask people what they need, they can tell you. And a lot of the time, they just need someone to listen. And that person will not solve the problem, but will give them that is the support they're looking for in that moment.
That's super helpful. Thank you, Faye. Lee, you shared with us a story from your childhood on how we look at asthma and Yay Mom. To clarify, with mental health in youth, as we understand it right now, because that's such an important point, we're still learning, there's more research. Is it environmental? Is it genetic? What about our own understanding of it, even when we're experiencing it or it's around us?
So the question is about whether or not it's environmental or genetic?
Well, it's the asthma question, right? Like, where are we at with, your mom's point back in the day?
I think it's the idea that we exist separate from our environment, I think, is a very colonial idea and a super medical idea. And I don't think those can be easily like separated from each other. So whether or not it's biology or environment is, I guess, maybe not a particularly separatable thing for me, because I don't think our biology exists outside of our environment. And I think our understanding of it does expand, but I think part of the reason why we keep pushing to learn more about it is because what we have learned about it is that it requires a bunch of changes that we don't feel comfortable making. I think people would be super keen if we could, pinpoint the DNA thing. I don't do a ton of medical stuff. I'm like the DNA point where it's like this particular illness lives and, zap it off of us. I think people would be super keen to do that. But when we know that, making a living wage is also suicide prevention, we're kind of like, but maybe we need to research more about this whole genetic thing. So I think we really try to depoliticize it by making it something that happens outside of the context of our environments.
Myrna, no, thank you. Myrna, I'd love to hear your thoughts, especially as it extends to racism.
Well, I was listening to Lee and I was thinking that's good, but what about this? And what I'm thinking about is that as with men and women, when women were always and continue to be defined through the lens of men, we tend to define Black people through the lens of whiteness, through the lens of white people. It's almost, if it's not white, if it's not Black, it must be white. Or if this happens within white people, it must happen this way within Black people. And one of the things we do, when you do the clinical intake interview, one of the things that we do is we try to determine what that illness means within that culture to that person. So we don't just say, this is this. We don't just go axis 1, axis 2. I spent a lot of time over on axis 4, to tell you the truth. We don't just go through axis 1 and axis 2 and say, this is the way it is in our precious DSM form. And I can do a whole thing on that, DSM 5, but we're not going to talk about that. And so I think it's important to recognize that when we do diagnosis, that is a political statement in and of itself when we do that, because we are defining people and we're doing that diagnosis through the lens very often of Eurocentricity. And we've got to stop and take a look at that.
Thank you for that, because that highlights white supremacy. That's what
I
we're
was
talking
trying not to use
I know,
the
but
term.
that's, yeah,
but
no,
that's
but
what I'm talking about.
let's identify it. But I also think you bring up a good point on also limitations of binaries and whether that's
Yes.
white and Black, but it also extends to gender as well. So thank you for that. We have a lot of audience questions coming in. Thank you so much to everyone who submitted. I want to start getting into those now. This is from Kelly in Calgary. In what ways do you see schools, for example, teachers, EAs, counselors, school psychologists, serving a significant role in the provision of support and intervention for students with mental health problems? Faye, you work a lot with youth and students. And actually, that's how we first connected back when you were a high school student. So yeah, I'd love to hear your thoughts.
I love that you brought up that we connected when I was in high school. And I also love that I feel like I don't look like I did when I first met you, which is great to me. So I have the privilege, and my team for the last few years has been working with School Mental Health Ontario. They've actually been doing some incredibly exciting work in this province to support school board leadership on mental health, to provide evidence, to bring best practices forward, and also to make sure that young folks are engaged in that process, that they're informing this work. What I would say is that any intervention we can put in place to help any young person access care if and when they need it is a good intervention. Anything that we can do in this system where there are still significant wait times for young folks to access community-based mental health supports, the closer we can get those supports to schools, the better. I think that our schools are some of the best placed intervention sites, right? Like if we can build wellness in schools, if we can support mental well-being in schools, and if we can also make sure our educators know how to triage folks to care when they need it, that we're making sure that we have those processes well understood and in place, I think that is an intervention that will improve mental health and well-being. Often, though, we have siloed sectors and siloed interventions. I wonder how much the Ministry of Education is talking to the Ministry of Community and Social Services. And so I think we need to see responses that are integrated, because any young person accessing any service related to their health and their mental health in particular needs not only to be accessing that service, but to be connected into a system that can support them on a range of issues based off the severity of their needs, based off what they're looking for in that moment.
Thank you, Faye. And that's my hope, that we can take out of the pandemic how interconnected everything is, whether we're talking about ministries or even in our own communities and lives. I want to get to more audience questions. Shailene asks, how can systems of care from home to community to acute care receive equitable funding and treatment access based on evidence-based research that's available? How can we move from what we know from research to supporting kids, youth, families, and caregivers? Terry, would love to hear your thoughts on that question.
And that's a big gap. It's like I think I read a statistic once out of the States. It's something like 90% of evidence-based research interventions don't make it into practice. So that research to practice gap is really huge. And that's where this idea of implementation science comes in. So this idea of like figuring out the real world stuff that leads to really often decreased kind of effects of research programs or interventions when they get out into the real world. So you need to actually trial it out. One way, just kind of building on what Faye was saying as well, is this idea of, we know that there's different levels kind of support that you can offer for mental health. So one is this idea of a universal level. And that, for example, in a school would be developing, there's evidence-based universal programs that are studied in school settings where, for example, they build in socio-emotional learning. So kids learn how to create cultures of kindness and compassion and acceptance. Then you can build in a level that we call targeted or indicated prevention, so that people are alerted, teachers and staff are alerted to knowing when kids are having difficulties. And then there's a large group of what we call targeted prevention programs that you can build in. So we work with some researchers in the United States where they've built in this family checkup program into schools, for example, where they have family resource centers. So families can go in and out of schools and access internet services, connections, they meet school staff. And then there's a targeted prevention program. So if parents or youth are having concerns about their mental health, they can enter into this next level, which can then connect them to clinical services if that's what they need. So this idea of there are programs out there, they need to be studied, and they also need to sometimes be studied together.
Really good point. Thank you so much. John's question for the panelists: are mental health systems effectively now starting to discuss how environment and generational trauma affects mental health? And if not, how can they do better? Myrna, I'm going to send that one your way.
Okay. Yes, it's certainly something that we're doing in my unit at the Jewish General, which is the mental health research unit, the MMHRC, the Multicultural Mental Health Research Center. We're starting to look at it. One of the problems has to do with education. In medical education, for example, psychiatrists, psychologists, we have not done a good job of teaching this. We're starting to do it, but it means that we have to change the way people have taught all along, have been taught and have thought. People have to do some introspection. For example, I'm not going to take a lot of time. Medical students had been taught, for example, that Black people don't feel pain the same way. And so painkillers that Black people may have needed to reduce pain, they weren't giving it to them because they were told that they didn't have the same sensitivity. Dermatologists were not taught much about Black skin. And so somebody might have come into the emergency with a child who had what is commonly referred to as Mongolian spots. That's not the technical term, but everybody knows what that means. So you have the spots, and the social worker was called because they were told, well, this child is being abused, which means that people, if the child needed care, might not have gone to the hospital because they were afraid that the social worker would come and take the kid. So we've got to do something about education. We've got to change the way we teach, not only in the schools, but among physicians and among the rest of the healthcare staff. Otherwise, it's not going to get better because there's nobody there to help them. So you can remove all the stigma you want, but if there's nobody there who's trained to teach those, they're not going to go.
Yeah, and that education's a life's journey. So even if you're a doctor, there's likely something new to learn or relearn as well. Thank you so much for that. This is a commenting question for Lee from Tina. What do you say to the youth who you spoke of about the issues you mentioned and who are feeling so hopeless? Tina agrees that hope is far from an adequate response.
So with a lot of the youth that I work with, this is going to sound like a really counterintuitive response. So I'm hoping you guys will bear with me.
We're here for it.
I really don't see like therapy as a place where people go to feel better, which I know sounds weird. But it's because I feel like in every place that people are, so if we talk about the youth that I work with, in every place that these youth are, they are told to stop feeling hopeless. Because when youth feel hopeless, it bums us out. We don't like when people are feeling hopeless and powerless and furious. So we're kind of like, here's why you're wrong to feel hopeless. Here are the things that you do have control over. Here's why it'll get better, right? And there's a time and a place for those messages, and I, no harm against them. But I really see my practice as a place where they can come and actually sit in how much that hopelessness sucks. which actually allows them to start doing something about it. When I can really be like, yeah, it does feel hopeless. Let's talk about it, as opposed to, yeah, it does feel hopeless. I'm acknowledging it. And now let's try to find a way to get you to stop feeling hopeless. Because I think that anger is a really powerful emotion. I think they are angry because they know that what is happening is not right. And I don't want them to stop feeling angry. And I think when they allow themselves to really sit with that, that's where they start feeling that hope and that intention, and the idea that their inability to live healthily in this pond is not actually because of them, it's because of the pond.
Lee,
I jump in because I love that. I'm just like, I think that is like my ethos. I like to like candidly joke that like my work is fueled by a rage. And I say that, but I'm like, it is. Like, I look at this world and this world is violent. This world is oppressive. This world hurts to survive in. And we actually need to be able to name that. I think feeling of hopelessness makes sense in a world with an impending climate apocalypse, with white supremacy, with homophobia and like, we live in a violent world. And I think channeling that and allowing people to come to terms with the fact that this world does actually suck can allow us to say, oh, my feelings actually do make sense. My feelings are a natural response to violence, to discrimination, to inequity. I think that it's consciousness raising. Like, I think so much of this conversation to me is paralleled with like emergence of feminist movements, right? Like this idea that we build consciousness in communities, and that in and of itself is liberatory, is powerful. And I see that as something that needs to happen in mental health. Our anger, our rage is valid. Our rage is legitimate. We have every reason to be angry because this world sucks.
and historically, that's what's changed the world.
And I would say we often think about like, medical kind of interventions can do harm. We often think about like things like medication and stuff, but you can do harm when you invalidate these experiences.
Absolutely.
And also when you offer kind of programs that are unhelpful to youth time after time after time. And that, in fact, we can kind of cause hopelessness when we're not being careful and we're not entering into those moments, as Lee and Faye were talking about. And that's kind of the power of relationships like psychotherapy relationships.
Well, thank you so much. I wish we had more time, and chat has been blowing up with questions and comments and brilliant response and lots of plus ones. So thank you so much again to all of our talkers. Again, Faye Johnstone, Dr. Myrna Lashley, Lee Thomas, and Dr. Teresa Bennett. Wow, so much to take away from tonight's event. And if you enjoyed the Walrus Talks at home this evening, there's more coming up in 2022. Keep an eye on your inbox. We're going to send you a follow-up email. And the best way to stay in touch with the Walrus and not miss out on any events like this one is to opt in and to sign up for our newsletter. To learn more about the Brain Canada Youth Mental Health Platform powered by RBC Future Launch, we are going to post a link in chat. Click on that and you can read more. The Walrus is a unique beast. We are a registered charity, which means that our content remains fiercely independent and it is sustained through the support of donors like you. So if you enjoyed this free event tonight, please consider making a donation by visiting thewalrus.ca. You can click on donate. We have a fall fundraising campaign underway right now to keep what we're doing alive, and all donations of $20 or more receive a charitable tax receipt. Thank you again to Vivian Poupon, Valerie Short, and everyone at Brain Canada and RBC Future Launch for making this conversation possible. Thanks as well to our annual sponsors, Air Canada, Inspire, Labatt Breweries of Canada, Meta, and Shaw. Community is so important in these COVID times, but also when it comes to youth mental health. So thanks for being with us tonight. Each one of you is part of the Walrus. Thanks for tuning in. Have a great evening, and we'll be in touch. Good night.